China's COVID situation appears to be worsening days after China loosened its hardline containment policy. Hospitals and crematoriums are reportedly struggling with an outbreak that authorities are claiming is currently impossible to track. Now, reports that are emerging out of China worryingly suggest crematoria are overburdened, hospitals are overflowing with patients, and pharmacies are running out of medicines. In fact, some health experts and modelers are estimating that 60% of China's population could become infected in the next few months, and more than 20 lakh people could even die. After years of sudden lockdowns, mass testing, long quarantines, as well as travel restrictions, suddenly China's easing of restrictions after massive anti-lockdown protests now seems to be boomeranging. The big worry is just how fast COVID is spreading in the world's most populated country. And also another big concern, of course, is whether China is currently underreporting the virus death toll as cases could be mounting. All right, let's go right across now exclusively to Sun Tianwan, who is joining us from Beijing. Thank you very much indeed for speaking with NDTV. Are hospitals and clinics in China, in fact, seeing far bigger number of patients right now? And what are you hearing? Which regions are reporting this, or is this all over?
Well, this afternoon, China's National Health Commission just held a conference, and it says the most urgent task for COVID-19 prevention and control right now is to ensure medical supplies and services and open more fever clinics, especially in rural areas of China. The Chinese mainland reported about 2,700 new cases yesterday in Guangdong province and Beijing mostly, and the latter saw 5 coronavirus deaths. The Health Commission says basic diseases are right now the main cause of Omicron death in the Chinese mainland, especially among elderly people with chronic diseases such as respiratory diseases. An expert from Peking University, First Hospital, actually said this afternoon that very few people have died directly of respiratory failure caused by Omicron, but the doctor did say the characteristics of COVID-19 have changed drastically from 3 years ago in Wuhan, where most of the patients died of the lung failure, and the virulence of Omicron has decreased significantly compared to the previous strains, such as Alpha and Delta.
Right.
It impacts mainly yes.
Yes. I do have to ask at this point, when you say perhaps COVID or the Omicron virus is not the primary reason and that there were other comorbidities as well, if we take all the deaths into account, is that a significantly higher number? Patients who have died perhaps of, what has been talked about medically as other reasons, but who also had COVID at the time?
Well, actually, China stopped accounting for those ones who were killed besides the direct impact from a lung failure or respiratory disease. So there's no way we can count the numbers right now, but I can tell you Omicron is far less deadly than the previous strains like Alpha and Delta, as we know. And this is actually getting a little better day by day. I talk to friends and medical workers in hospitals, and they say the first few weeks were quite tough, but they managed to come through, and they're seeing new hope. But actually, this afternoon, the expert actually warned that we were expecting
I do have to ask, do people in China perhaps have less immunity even to Omicron, given that there have been such tight restrictions in the past, such strict quarantine measures that very few people have natural immunity?
Well, that for scientific facts, we don't know yet. But one thing is that Omicron is not as deadly as the previous strains, but it spreads so fast right now. And we need to find a way to curb it. But we're expecting more waves coming next year in the spring because the spring travel rush, spring festival travel rush is coming. But experts warn that we should take that into account. But we do not panic because Omicron is not as deadly as the previous strains, and there's new ways we can deal with it.
What are these new ways? What are these new ways, given that Omicron is spreading as fast as it's doing? Is medical infrastructure going to cope with the kind of trajectory we're likely to see, given that we're seeing a doubling rate, which is now in hours now, not even days, from all reports?
Well, as I said before, I actually talked to medical workers just a few days ago, and they say everything's getting a little better, so we should not panic that much. But the government is asking to build more fever clinics, and they're opening more fever clinics as we speak. Actually, in Beijing, they actually building more fever clinics for the people. Everything is people-centric. The policy, we need to change because people can't just stay at home forever. We need to open up a little, even amid the outbreak. But I'm pretty sure we can find a way to...
What changed so suddenly after so many months of very strict containment measures? Was it just the widespread protests against the lockdown measures that prompted the Chinese government to completely do away with restrictions?
Well, actually, that's not true. We're actually optimizing the policies day by day, but due to some sudden changes, we have to open faster to cope with the current situation with the world, and together we fight the war against COVID-19 as a whole, not just China. This is not just a Chinese problem. This is the whole world. China is a part of the supply chain. You cannot just ignore what's happening right now in the country. We need the economy going back to stable growth. So that's what's happening right now. Change. That's what we need.
Well, certainly change, but what about medical staff at this point? There are worrying reports that medical staff are now getting affected. They're handling such a large number of cases that they themselves are struggling, and many are down with COVID. Can you confirm those reports?
Actually, like I said before, I talked to medical workers, and they're quite optimistic at this moment. Before, like a week ago, they were hit hard, but they adjusted, and some of them came back to work after a week of infection. They recovered. So now they're back to work and helping more people, especially the elderly and the kids. As you mentioned, the hospital is having a little challenge right now, but let's be honest. Omicron, it spreads so fast. There's nothing you can do to contain it with absolutely.
So when you say that, is there a real fear that hospitals could get overwhelmed in the next few weeks ahead?
That I can't say for sure, because right now the hospital, I'm not seeing any crushed hospitals. They are crowded, but they're not overwhelmed. People are still functioning. The hospital is still functioning, and the patients are queuing for medicine. And some of them decided to stay at home, to quarantine at home and drink water, as some experts suggested, and have some fever medicine to kill the heat. And that's it.
So is there public messaging at this point that if your symptoms are mild, do not come to hospitals because then there could be overcrowding?
Well, it's not a public message. It's like you don't have to go to the public. You don't have to go to the hospital unless it's really severe. And 95% of the symptoms right now is like mild or easy symptoms. It's not like it's gonna be the end of the world tomorrow if you don't go to the hospital.
Right. One last question is this a policy? Is the current policy being calibrated in any way? Could we, in fact, see some kind of reversal where China heads back to a more tighter lockdown policy than we're seeing currently, if, in fact, cases go up in a massive way?
Well, as you witnessed before, China is actually optimizing all the rules to open even more, even amid the outbreak. They are trying to find new ways to curb the virus and actually have the social, economic activities in normal trajectory. I'm not sure, but it's not likely China will go back to a tighter lockdown situation. I think everything is getting a little better right now. So let's have some faith, okay?
All right. Sun Tianwan of the Chinese state-owned CGTN, thanks very much indeed for joining us on this discussion.